Sir, tibial plateau fractures constitute 1% of all fractures and 8% of all fractures of elderly. Bicondylar fractures are complex injury frequently associated with soft tissue injuries, and it requires restoration of articular congruity as well as axial alignment. Best treatment modality is still controversial. Risk of unsatisfactory results are very high with improper treatment. So what controversy? Lateral buttress plating versus dual plating. Orwich et al. Suggested that dual plating provides higher stability and prevents medial collapse and subsequent varus deformity. However, AO favors lateral plate osteosynthesis. Osteosynthesis depends upon balance between the rigid fixation and preservation of local biology. Dual plates may hamper the biological environment more as compared to the lateral plating. With newer implants and techniques like LIS, some bicondylar fractures have been managed by lateral plating alone. However, biomechanical, clinical, and cadaveric studies show that dual plating allows lesser subsidence and lesser chance of varus collapse. Also, Vary et al. Demonstrated using a CD-based study a presence of posteromedial fragment in bicondylar fractures in up to 33% of cases. An Indian study by Nugi et al. In 2015 also concluded that dual plating with 2 incisions resulted in better joint reduction and joint alignment with acceptable soft tissue complications. So problems with the bicondylar fractures are there is extensive damage to the soft tissue leading to contusions, open injuries, compartment syndrome, neurovascular deficit, joint incongruity, and axial malalignment. Osteoporotic bones in elderly, problems with fixation due to inadequate bone stock and inferior bone quality. So usual investigation is X-ray in 2 planes and also 45-degree oblique view for the subtle fractures, CT for better visualization of individual fragment, and it is the investigation of choice for the management of the proximal tibia fractures. MRI to rule out meniscus and ligamentous injury, but it is usually not needed. Angiography in suspected vascular injuries. So pre-operative assessment has to be done very meticulously regarding soft tissue damage, degree of dislocation, degree of comminution, degree of joint involvement, osteoporosis, and neurovascular injury. So goals of treatment is decompression and preservation of the soft tissues, reconstruction of joint surfaces, reconstruction of normal mechanical axis, and early range of motion. So indication of emergency surgery in this situation is for vascular injury, compartment syndrome, open fracture, gross dislocation, floating knee, and polytrauma patients. So usually we go for anterolateral approach and the posteromedial approach. So one case is 35-year male with history of RTA leading to the bicondylar fractures. These are CT pictures. These are 3D reconstructions. And this is immediate post-op. Another case is 30-year-old male with history of RTA leading to bicondylar fractures. And this is post-op pictures. So take-home message is delayed surgery for soft tissue recovery, 2 incision instead of anterior midline incision, dual plating with lateral buttress and medial posteromedial anti-glide plate, early range of motion and delayed weight bearing. Thank you, sir.